Guys, it's the end of my day and I'm going for a walk, and I figured while I'm walking I'd talk to you guys about atrial fibrillation. I'm going to try and make sure that I don't trip on the sidewalk and fall down while I'm talking to you guys. That would certainly be entertaining. But anyways, what is atrial fibrillation? So imagine a baseline. Your heart should be beating at a regular rhythm. There shouldn't be skipped beats and there shouldn't be pauses. And you can kind of use an analogy and think of your heart as dancing to the rhythm of music, and it should dance on beat. When you have atrial fibrillation, your heart is kind of dancing off beat and listening to its own music despite the music with the appropriate rhythm playing. So the problem with atrial fibrillation is that there are moments when your heart kind of skips a beat or pauses, and in those moments when your heart pauses, the blood that is circulating around your heart and around your body can become thick. So imagine your heart pausing and then it starts beating again, and that thick blood travels to your brain. If that happens, that can cause a stroke. So that's one of the major complications of atrial fibrillation. So what do we do when somebody has atrial fibrillation to get the heart to beat properly again? Well, there are a couple of things we tend to do. One of them is called cardioversion. So cardioversion is essentially shocking the heart and getting it to get back into rhythm. And there's two different ways to do cardioversion. There's one that's called mechanical cardioversion, where they put somebody to sleep or sedate them, and then they shock their heart. And the reasons to do that vary. It depends on how long the person has had atrial fibrillation and what kind of symptoms they're having. In other cases, we do what's called chemical cardioversion, and in that case, we use medications to help the heart get back into rhythm. The other thing we have to be concerned about, even if we do get the heart back into rhythm, especially if we're taking the chemical approach of cardioversion. Oh, this person, too much noise. Okay, so going back to the thing we're concerned about, strokes. So if the blood becomes thick, we're worried about strokes. One of the things we do to prevent that is give people who have atrial fibrillation blood thinners. And not everyone who has atrial fibrillation gets blood thinners. We look at certain risk factors that increase the risk of stroke, specifically the person's age, if they have diabetes and high blood pressure, and their gender, in addition to atrial fibrillation. I hope that was helpful, and I hope you guys can hear me.